All right, I am going to go ahead and get started here today. My name is Tom Wright, and I head up the Health and Medicare Department here at GoldenCare, and I certainly appreciate you taking time to join us this afternoon. No matter how you cut it, 2020 has just turned out to be, quite a year between COVID-19 and then, the hurricanes and the fires out west. It's just been a challenging year for everybody. And so we certainly hope that you and your family are all well, during these tough times. I do appreciate everyone's effort, though. I think our industry in particular has done a great job to respond to, these challenges as we go forward. And we anticipate, this could be a busy AEP. One of the odd things about insurance is sometimes in tough economic years, people will kind of poke their head up and they'll say, hey, do I have the right coverage, to cover, my needs given all the challenges with COVID-19? And so it's not unusual for us to have above average sales in years that are a little bit tougher. And so, certainly want to, thank everyone, for their efforts and some of the challenges that come with that. One of the things we're really focused on this year is, just helping everyone simplify the way they enroll people in new plans and manage their clients. And so earlier this spring we did some remote selling webinars where we covered some of the different platforms available for presenting to your folks over the phone. We're going to repeat some of those here in the next couple of weeks as well, but I wanted to just mention that as well. Now I'm having a little trouble getting my slides to advance, but there we go. So just over 2 years ago, GoldenCare became part of the Integrity Marketing Group, and that was after 45 years of doing business under the GoldenCare name here in Minnesota. And so, we've always worked as a regional player in the Medicare Advantage markets. We've also worked as a national distributor in the long-term care markets, but today we have partners across the country, and John Michael-Isaac from my office had actually been making fun of me that there's actually almost 50 companies today, so my map is very old, but one of the things that's great is we've been able to operate as a local company servicing our agents, but we're also able to bring some better tools and more innovative products to the market due to our partnership with the Integrity Marketing Group. So it's been great overall. We do act as a full service FMO, including helping people with new product strategies, of course all the contracting and certification. There's all kinds of product training, sales support that we provide. I did throw a couple slides in about some of the marketing we're doing for this AEP, but today we'll really mainly be focused on the MedicareCENTER program as we go forward. I did want to give a shout out to our product development team at Integrity Marketing Group. There's a team that has been working with a lot of the leading companies from across the industry to develop new Medicare supplement products. And so certainly they're both tier 1 and tier 2, what we call tier 1 and tier 2 companies, but just recently Humana launched a new Humana Achieve product in Wisconsin, and that has some of the most competitive rates in the market. We also have Lumico and Union Security in North Dakota and other markets. We anticipate that some of these will be coming to Minnesota soon, but just wanted to give you an update on this. This development of new products has been a key part of our corporate-wide strategy at the Integrity Marketing platform level. Consumer marketing is another thing that we're always focusing on this time of year, and we certainly have campaigns that are in some respects moving back into some of the more generic things. And again, I mentioned before that sometimes people are paying more attention to their coverage due to what's going on with COVID-19, and so we're doing campaigns around things relating to premiums. Just cost of course is one of the things that help drive leads to our agents and agencies that we work with, and so that's certainly one of the themes. We also have things surrounding educational seminars. We have programs around getting a no-cost review of your coverage, and so we're always working to have different types of generic and consumer marketing that will, help you better serve your prospective clients and your existing clients as well. Educational webinars are also, a thing that, we're seeing some additional traction on this year. And again, I think part of that's due to COVID, but, we continue to have a dynamic turning 65 market, and so we certainly got other types of resources to help you better reach, some of those clients going forward as well. But the main subject for today's webinar is really the new Medicare Center. And when I say the new Medicare Center, it's because over the last 2 years, we've had agents across our market and our downline agencies using an enrollment platform that has been in development over I think it's actually four years in development. And so we've had, some great success with this platform, but there's just been a number of enhancements to it this year, and we're certainly very excited to share some of that with you today, and we can, and see how it, can better serve you. No matter what, as agents, between doing certifications and all the different kinds of things, we're pulled in a number of directions. But even when it comes to enrollment platforms, each company has their own enrollment platform, and actually some of our Medicare companies have actually more than one platform that's available to do enrollments. And so it can be challenging to, navigate all those different logins and those different programs. But, there's a lot of things that kind of come into that, including the scope of appointment. How do you get the clients to sign that? How do you, manage their drugs and different things to evaluate, quote, and compare their plans? So this new Medicare Center platform has really, has a lot of enhancements that will help you, reduce the busy time in just navigating all these different platforms, and will help you streamline the enrollment process. So the platform covers Medicare Advantage and PDPs, Medicare supplements, and also Client Manager. So the key is the Client Management. There's a simplified CRM built into it that will allow us to quote and compare plans, and then finally enroll the clients into the system. Within this CRM, you can manage your clients electronically on any device. So once they're entered in the system, it's easy for you to track, where they're at, what kind of coverage they have, and then also, quote and compare plans going forward. It's really simple to use. As a matter of fact, you can create a client with just an email or a phone number, which allows you to capture those folks and get them into the system, and then you can always backfill all the additional information you need. But it also has features that allows you to schedule next communications and next steps with any client, whether that's, following up on an enrollment or maybe just checking in with them on, a plan that maybe they've had with you for years. And so this simplified CRM, we feel like, is a really good balance between, some systems in some respects maybe get a little too complicated, and so we're always working, to just put things that are useful, to our agents out there. I mentioned earlier that there's everyone, it's been great. All of the companies have worked very hard to make sure we have enrollment capabilities. But again, having all these different logins and different platforms that work differently can be a time-consuming process to do that. So one of the biggest features of the Medicare Center platform is it's an all-in-one universal login. So once you logged in, you're able to manage all your clients and all your companies electronically. The Learning Center is a new addition to the platform as well. It will have information like on carrier programs, some of the training that they have available, but we also have some integrity content on industry best practices. But maybe most importantly this year, it also has all the learning tools on how to use this platform and those things going forward. The other thing that we're excited about is there's going to be a sandbox feature built into this that will be released where you can go in and play around with it and learn how the systems work before you're actually working with it on a client. So those are all things that are coming as we do the rollout here in the next couple weeks. So on the Medicare Advantage side, there's actually two platforms built into this. And so, again, it's one universal login for the platform. But then once you're in, there are a couple different, systems available to you. And the greatest thing about it is that it's all free of charge. So if you're contracted through GoldenCare or an Integrity partner, you get access to this system at no cost. And so Medicare app is actually the main platform that's been built into MedicareCenter from the beginning. It's actually built on the ConnectSure platform. And so ConnectSure is one of the main Medicare vendors. It's actually what Medicare.gov runs off of. And so, it's certainly a widely used technology, and that continues to be kind of the cornerstone app within this program. There's also an additional platform built in called Medicare Link, and this used to be called Surefire, and there's certainly agents and agencies that we work with across the country who have used the Medicare Link platform as well. And so together these two platforms are providing great options for our agents across the country. Medicare app, so again, this is that traditional thing. So this gives us the capability to shop, quote, enroll electronically on any device. It has access to an extensive list of carriers, which we'll cover in a bit. It also estimates the cost of using or estimates the cost of all the different types of plans as you go forward. The great thing about it is you can really get the most accurate drug costs available for people. So not only can you enter their drugs, the dosages and all that kind of information, that will go into the system, and then that's in there, that's archived then in the system, so you have access to your client's drug information from year to year. But then you can also pick the pharmacy that they actually go to. So you plug in the zip code, and then you can pick, as you can see in the illustration in the slide, there's Mickey's Fine Pharmacy. And so, I think this provides a lot of flexibility on how to give people, the best pricing available. This to me, kind of just in working with agents over the years, may be the most significant, improvement to the overall system. For years, we've been using electronic systems that have been promoted either, through a carrier or through previous versions of MedicareCenter, but the clients always needed to have an email in order to do the enrollment. So if they didn't have email, we often had to revert to a paper application, mailing it, and those type of things. Today, we've incorporated a text message system where anyone with a smartphone can get a text message to enroll in the Medicare Advantage plan that you're working with them on. So you go through, you fill out all the information, select the plan, and then they receive a text message to sign the application. There's also a text to sign SOA, which is actually step one. So if you're working with someone over the phone, you can send them a text. They can complete the scope of appointment. That then is saved for you. So it's really a great system, an enhancement to the MedicareCenter platform that we've had over the last couple years. So for all of you that have used that in the past, you're going to love this new system that comes with it. The other thing is that, again, all the prescriptions, kind of preload. So you can either use Medicare.gov to sync, with this program, or you can enter the prescription drugs where it, pre-populates based on the letters you put in. But it certainly reduces errors. It also keeps, a current list of all the drugs and the dosages, which is a big help in the overall system on quoting drug systems. I mentioned Medicare Link before. In many ways, there's a lot of similarities between these. Some of the agents have used Medicare Link, so they have access to, some of those systems. But again, you can search plans by the client's doctors, compare their current health plans or with those available in the market. You can do the scope of appointment by text or email. And again, the enrollment piece is built in. So, both of these maybe are a matter of preference because there is some overlap. I do think the Medicare app has a little more extensive list of carriers, but there's certainly a lot of folks who use this Medicare Link, which used to be called Surefire. So that's been kind of rebranded within our platform. Surefire is still out in the market in general as well. I think that, the main thing is it's also just a super easy, design to use. You can quickly quote, follow up, and then start an enrollment based on each client and what their needs are in the market. Again, it can work on any device. And then there's some reporting tools, built in to track performance and success, as you go forward too. So all of these are, great improvements to this. So, as I said in the introduction, we certainly never know, what's going to happen during each AEP. But there is some suggestion that, sometimes in years where things can be there can be turmoil in the market, people do have a tendency to want to at least maybe review their coverage and make sure what they have is good. So we feel like enrollment tools like this will just help you navigate these AEPs both in more remote and safe aspects, as well as just some of the volume that may come with it overall as well. Now we haven't forgot about the Medicare supplement piece as well. So also built into the MedicareCENTER is we've built in the CSG actuarial tools as well. And so historically we've offered MedicareCENTER and CSG to our downline agents at no cost, but they were separate platforms and had varying capabilities. So again, one of the great things about the new platform is it's all integrated into one. So again, this is the same login as we go forward. Again, if you're familiar with CSG, you can easily enter people's basic information and get quotes for the Medicare supplement plans in their areas. In most states, Medicare supplements are priced based on age. So not only are there factors including, whether they're, male or female, or pricing based on zip code, and then pricing based on household discounts. Just calculating a rate on a Medicare supplement plan can be a challenge in itself. And so this CSG platform will simplify all those things and help you find the right plan for your clients and get a good sense of what some of the leading companies are in any given area. And anyone who's got non-resident license and working across multiple states, which of course it becomes more and more common, these tools are absolutely essential to your overall business. I mentioned earlier that 9 out of 10 of the national carriers are in it. There's also a number of local carriers in markets across the country, and so we're certainly working all the time to add new companies to the platform. And as we go forward, we will we'll continue to update all the different companies that can be enrolled on this. And so for so many of our agents who use us for some of all the national companies here, they're able to handle a big part of their business under one platform, which has been great. Finally, that's kind of the 10,000-foot view of the new MedicareCENTER platform. We'll be having additional training and information once you log into the new platform, which will be launching within a week. There's additional platforms. This is designed to give you the 10,000-foot view. But I think, again, overall, this is just a great platform. And, we certainly want to encourage you to reach out to us here at GoldenCare. You'll notice there is some support within the integrity, group as well if we get, more advanced questions and things like that. But, we're certainly very excited about this new uniform platform and what it can do for us to simplify enrollments going forward. So anyway, I appreciate everyone's time today. I will unmute the phones here and see if there's any questions as we go forward. So hang on a second.
Say, Tom, this is Jeff Lund. Can you hear me?
Hey, Jeff.
Hi. Are we able to enroll and do scopes on texts right now?
That will be coming here in the next week. There are, some carriers have come up with a text solution, but the current MedicareCENTER does not have the text for scope, but the new one will, and that will be going. Well, it really doesn't go totally live until October 1st. When you'll be able to quote the actual plans and talk about new plans. But our hope is the sandbox will be open, and but it's my understanding that scope may not be, the text scope may not be available till October 1st. So.
Okay.
It's a good question. No, it would be nice if we had it today, but because the old platform doesn't have it and the new one does, that we just have a slight gap in that system right now. So.
Sure. But
other questions?
Can you do texting on?
Pardon me?
What other, you said some of the companies do have text to enroll.
Yeah, I think Humana has a text message scope of appointment now, and I'm trying to remember. I think CSG has one as well. So we may have to put out an email on the number of companies. I know during COVID, different companies were bringing that capability online as we went through the summer here. As everyone was trying to rally to get some remote capabilities. I know Medica is rolling that out as well. So
yeah, Aetna has that with the Ascend app as well to enroll.
All right. Well, again, thanks to everyone. I hope you have an opportunity to reach out to us. We're here, kind of navigating through those final steps of making sure everyone's certified. Be sure to double check. We have more companies in the market than ever, and we always encourage everyone to double check all their certifications, make sure they're up to date. We try to monitor that and let you know, but it's up to all of us to keep on top of those pieces. And then as well, if you have questions or ideas on marketing, we're certainly interested in visiting more about that as well. So with that said, I think I'm going to put a wrap on this, and I hope you all have a great day and a great AEP, and watch for more news to come. Thanks again.